Wisdom tooth removal. For so many of us, it's a rite of passage, right? But what's actually happening behind the puffy cheeks and, the required ice cream diet? Well, we're going to pull back the curtain on this super common surgery and break down every single step. So, have you ever really stopped to wonder? I mean, beyond all the stories and the jokes, what is the surgeon actually doing in there? Let's walk through the entire surgical playbook together, right from the first prep to that very last stitch. It all starts with this one core problem, an impacted tooth. This is the whole reason for the surgery. The tooth is literally stuck. It's blocked by bone or tissue or even other teeth. So the surgeon's job isn't just to pull it out. First, they have to create a path for it to be removed safely. Now, before a single instrument even gets picked up, the first and honestly most critical phase is all about preparation. And this isn't just about, getting ready. It's about creating a completely controlled, completely sterile environment so the surgery can be done as safely as possible. Just look at the level of detail here. It's like a 5-step ritual to guarantee total safety. The patient is positioned for the perfect angle, the instruments are laid out in the exact order they'll be used, and the surgeon scrubs for up to 5 minutes. It's this whole choreographed process where every single step is just another layer of protection against any kind of infection. I just love this detail from the source material. It compares the way the patient is draped to a nun's veil. It's such a powerful image, right? It really shows you how completely the surgical site is isolated, creating this super focused, sterile field where the only thing that matters is the procedure itself. And of course, making sure the patient is comfortable is absolutely paramount. So the choice of anesthesia is totally tailored to the person and the procedure. It could be anything from a simple local anesthetic, that's the most common, to IV sedation for patients who are a bit more anxious, all the way to general anesthesia for the really complex cases. Okay, so the stage is set. The patient is comfortable. Now the surgery actually begins. And this first step, it's not just a simple cut. It's all about strategically creating a gateway to get to that hidden impacted tooth. So surgeons basically have two main choices here. For the simpler cases, they'll use what's called an envelope flap. It's a pretty straightforward incision that heals up fast, but for a tooth that's buried really deep, they need much better access, so they'll create a triangular flap. It's a strategic call they make before the surgery really even gets going. All right, now we're getting to the heart of it. This is the part where a lot of people probably imagine brute force, but the reality is the total opposite. Modern wisdom tooth removal is really an art of precision and strategy. It's all about finesse, not force. A huge part of that strategy involves removing just a tiny amount of bone. This does two things. First, obviously, it clears any bone that's blocking the tooth's path. But second, and this is so important, it creates what's called a purchase point. It's a little space where the surgeon can slide in an instrument called an elevator to gently start loosening the tooth. There are really two main ways to do this. The most common way today is with a high-speed surgical drill, or burr. It's incredibly precise, and it has this constant stream of saline to keep the bone cool. The older, more classic technique uses a chisel and mallet. Now, it's still effective, and specialists use it, but as you can probably imagine, that jarring effect makes it a little less popular for patients who are awake. The technique has just become so refined. With what's called the guttering method, the surgeon doesn't just shave bone off the top. Instead, they drill a very precise channel right alongside the tooth. This creates the space they need while preserving the strength of the buccal plate. That's the outer wall of your jawbone, which is absolutely critical for the jaw's long-term strength. This quote from the text, this is the core philosophy right here. If the tooth resists just moderate pressure, the surgeon doesn't just push harder. They stop, they reassess, they either remove a tiny bit more bone, or more often than not, they switch to an even smarter strategy. They decide to section the tooth. Tooth sectioning is the ultimate example of working smarter, not harder. Instead of trying to wrestle out a big, awkward tooth, the surgeon just divides it into smaller, more manageable pieces. And look at how precise this is. They only cut about 3/4 of the way through, then they gently split the rest. Why? To protect the nearby lingual nerve. That's the nerve that gives your tongue sensation. It's all about safety and control. So, as you might guess, not all impacted teeth are the same. Not even close. The angle that the tooth is stuck at completely changes the surgical plan. The surgeon has to adapt their entire strategy based on the specific type of impaction they're looking at. This chart shows you exactly how the angle of the tooth changes everything. See that mesioangular impaction? That's when it's tilted forward, toward the front of your mouth. That's the easiest one to get out. But oh boy, the difficulty just ramps up from there. And the toughest challenge of all? That's the distoangular impaction, where the tooth is tilted backward. So what makes that one so tricky? Well, because the tooth is tilted backward, its only way out is blocked by the ramus. That's the solid vertical part of your jawbone. To get it out, the surgeon has to carefully remove bone from behind it and then maneuver the tooth up and back. Any kind of excessive force here could literally fracture your lower jaw. This is one that truly requires a specialist's touch. Okay, so once the tooth, or all the little pieces of it, are out, the surgery is not over. Nope. In fact, what comes next is just as important for making sure you have a smooth recovery without any complications. It's time for the cleanup and closing. This whole thing is called debridement, and it's a super meticulous 4-step cleanup. The surgeon cleans out the socket, they smooth down any sharp edges of bone, they remove the little tissue sock that was surrounding the tooth, and then they flush everything, and I mean everything, with saline. And that last step is so critical. The source material directly links this thorough irrigation to a much lower chance of developing a painful dry socket. Finally, a few sutures are placed to guide the gum tissue back where it belongs. And what's really fascinating here is that the goal is not a watertight seal. The sutures are actually kept just loose enough to let things drain naturally. If you seal it too tightly, you could trap fluid and cause even more problems. So again, it all comes back to finesse. So, after going through all those steps, what's the big picture here? What are the core philosophies that guide this surprisingly complex surgery? It really just boils down to these 4 principles. First, preparation is everything. Second, the removal is all about strategy, not strength. Third, the surgeon has to adapt to the unique challenge that each tooth presents. And finally, that meticulous cleanup is absolutely critical for proper healing. You know, this slide really says it all. This isn't just a simple pull. It's a whole sequence of calculated decisions. Every single action, from the type of incision to the angle of the drill, is deliberately chosen to make sure the outcome is as safe and effective as it can possibly be for the patient. This surgery has evolved so much over the years, becoming safer and more precise. It really makes you wonder, what's next? As our technology gets better and better, what do you think the next big innovation will be that makes a procedure like this even less invasive? It's kind of an exciting thing to think about.